Good morning. Are you Oakland?
Good morning. Yes, I am.
Can you confirm your date of birth for me?
November 18th, 1993.
Perfect. So my name is Haley. I am one of the nurses here at Harmony Rheumatology Clinic. Dr. Lewis has recently told me that you've been diagnosed with lupus. So how are you holding up with that diagnosis?
Feeling a little overwhelmed. Just so many emotions since hearing about the new diagnosis of lupus. It just doesn't feel real. So I do appreciate you taking the time to speak with me. And like I said, this is also very new to me. Could you start by explaining to me what SLE is?
Yes, absolutely. So SLE is an abbreviation for systemic lupus erythematosus. This is pretty much where your immune system is attacking your healthy tissues within your body. It is also a chronic autoimmune disease, and the immune system is the defense mechanism of the body. So it tries to get rid of any pathogens that are in the body. So it's pretty much looking at your healthy tissues as a pathogen within your body. It can affect organs such as the skin, joints, heart, kidneys, lungs, and even the blood cells. So in your case, we are seeing that the lupus is affecting your joints and skin, which is also why you are experiencing fatigue, joint pain, and you have that butterfly rash that you have presented with today.
Okay, I've also been having morning stiffness for about an hour and swelling in my wrist. Is that part of lupus too?
Yes, absolutely. So lupus is common for inflammatory arthritis, especially within the hands, wrists, and knees. The stiffness that you have been feeling in the morning and the swelling that we saw on your first exam are all lupus findings. But the good news is that the joint pain is preventable when lupus is treated early, and in your case, it is.
Okay, that's good to hear. So I noticed my hair thinning, and sometimes I've been getting these weird sores in my mouth, but they don't hurt. It just seems strange. Is that all connected?
Yes. So hair thinning, photosensitivity, and painless oral ulcers are actually all very common characteristics of lupus. They can feel strange to unexpected if you have never experienced anything like this before, but it does help us confirm the diagnosis.
But my labs were abnormal also, and that really concerned me. Can you explain to me what that means?
Yes, absolutely. So here we have positive ANA, and we have anti-double-stranded DNA, anti-Smith antibodies, which help confirm the lupus diagnosis. Your complement levels were low, which tells us that the disease is active right now. And as for the other blood work that I have listed, it also shows that your disease is active right now. And it also showed that you have mild anemia and low white blood cell count, which all of these are also common for lupus. We will monitor these closely with routine labs like CBC, CMP, your urinalysis. The lab will allow us to track if it's still active or how the progression of this autoimmune disease is affecting you.
Okay. I had traces of protein in my urine. Does that mean my kidneys are failing?
Not necessarily. The protein is an early sign that your kidneys are involved. But right now it's mild. This is why routine lab monitoring is so important, just so we can catch any kind of kidney involvement or kidney changes and try to prevent long-term damage.
Okay. They've started me on hydroxychloroquine. I can never say that right. Is that something that I'm going to be on long term?
For most patients, yes. Hydroxychloroquine is a common medication for lupus patients. It helps symptoms, it helps reduce flare frequency, and protects the organs over time. It is also generally tolerated, especially when monitored closely.
Okay, I've started taking ibuprofen also, but it barely touches the pain. Is that normal?
Yes, mild, or it can be, NSAIDs, like ibuprofen, can help with mild pain. As for lupus, inflammatory is an inflammatory, so any lupus related pain it won't really affect it. You will need additional treatment. And as we continue to monitor, Dr. Lewis may have to either increase your dosing or decrease your dosing depending on if you have any more flare-ups or if you have any more joint pain or any more symptoms related to the lupus.
How can I tell if I'm in a flare-up?
So that's actually a great question. I'm really glad that you had asked. So there are a couple things that you can determine if you're in a flare-up. Worsening joint pain or swelling, extreme fatigue, fever, rashes, more hair loss than normal, chest pain, swelling around the eyes or legs, and dark or foamy urine. But don't worry though. We will teach you how to track all of these symptoms, and you will be able to recognize any of these symptoms when they occur. But when in doubt, you want to give us a call. Never too late. Always, if you are concerned about something, give us a call, because we never want it to be too late.
Okay, good. I was worried about that. I'm starting to get a little overwhelmed here.
Absolutely.
Before coming into today, I did a quick Google search. I know. And it stated that I needed to make some lifestyle changes.
Mm-hmm.
What does that mean?
Yes, a Google search. So I would say no, don't do any more Google search since you had just recently been diagnosed with this. I know it's hard, but Google's not always right. But a lifestyle change typically means that you need to change the current habits that you are currently having or currently doing in your everyday life. So some of these could be applying sunscreen whenever you go out. Sunlight does affect lupus. It causes flare-ups. Prevent any UV lighting. If you love to tan, I'm sorry, you won't be able to tan no more. Try having a consistent sleep schedule. That is way easier said than done. I completely understand. But we gotta try, because that is also a big indicator of a flare-up. We also would like for you to manage your fatigue. Try to see how frequently you're fatigued and things like that. And maintain a balanced nutrition and hydration diet. So make sure you're drinking plenty of water and eating plenty of vegetables, fruits, meats, getting everything that you need within your diet. We need you to maintain strength, and so by that you would have to do minimal exercises, maybe going for a walk or doing things like that. And we want to reduce the stiffness, so doing those things, keeping your body moving, will help with that. And we want you to try to reduce the stress that you are having. So this is easier said than done. I get it. I understand. But that is one thing we would like for you to do. Now, with all that being said, on the bright side, I have put together this personalized SLE wellness finder for you. So in here, it has the medication lists, the symptom tracker. So if you are having any symptoms, you are more than welcome to write them down and, keep track. It has a flare-up action plan. So here it says if you have any flare-ups, this is what you would do. Any space for any questions between now and then. So if you leave here today and you are very overwhelmed, which I get it, you will be, and you have a question, say next week, and it comes up, just write it down here. Next time we see you, we can address that. And then it also has all of the education information that you will need. So here is that for you.
Oh my goodness, thank you so much.
Yeah, of course.
I am a little worried about my job and my family. Mm-hmm. I'm an office manager, I'm a mother of two. I'm afraid I'm not gonna be able to keep up.
Absolutely. A lot of people are very nervous and scared when it comes around family and friends and things like that when being recently diagnosed with something like lupus, any autoimmune disorder, or really any kind of disease, really. So I would recommend making sure you are pacing yourself Plan on taking rest periods, and also listen to your body. That is one of the biggest indications, is you have to listen to your body. Your body knows best. You may need to adjust the routine, and that is okay. If you have to change some things in your routine, it's going to take a while to get used to this diagnosis. But we are all here for you. We will get through this together. I'm here to inform you for anything that you could possibly think of. And also have open communication with your employer. Your employer should understand and try to make it a point to understand what you're going through, and try to keep your energy as much as possible. I know that's so hard to do, especially since you're an office manager, but try to save some of that energy.
Okay, no, and that's understandable. Thank you for reassuring me.
Yeah.
Ever since I was diagnosed, I've been feeling anxious, and so many emotions. Is that common?
Absolutely. So that is pretty much what I am here for. And any questions that you have, I will answer to the best of my ability. Feeling anxious is very, very common. Lupus doesn't affect the body, just affect the body. It also affects the emotions, your mental status. It affects a lot. And anxiety it also causes lupus flare-ups. And I know that is so bad, but it does. And it will only worsen the more that you experience anxiety. So, try to keep that minimal. Like I said, it's easier said than done. But you can do some Google research on how to maintain your anxiety levels. But I wouldn't dig too much into it. And then it is very important to see a mental health specialist, or make it part of our treatment plan for today. And I can also provide any referrals to therapy, support groups, or community lupus resources.
Okay, I think I'd like to try the therapy first.
Okay.
How often would I need to attend, do you think?
So you would at least have to attend therapy once every month.
Okay, I'm sure. When should I be concerned enough to call the office?
So if your symptoms worsen at all, so if you experience chest pain, any shortness of breath, increasing leg or facial swelling, new or worsening confusion, high fevers, or major changes in urination, all of these symptoms could be a sign that there is organ involvement, and it should be evaluated immediately.
Okay, what is one thing you would suggest that I do with my recent diagnosis?
Well, I highly recommend taking care of yourself. With that, I mean taking your medications exactly as prescribed. I have added your medication list in your SLE Wellness Binder, so you are more than welcome to take a look and make sure you're taking them as prescribed. Attend any follow-up appointments for the next 4 weeks. I also have that in your binder, when your next appointments will be. Complete any labs as requested. Dr. Lewis will request labs. I'm not sure when the next lab result will be. We will schedule that at the end of your appointment. And then track your symptoms and engage and support resources and as recommended. And all of the steps will help control the lupus and protect your organs from long-term damage.
Okay, I'm going to be honest. Although I do feel relief finally having some answers, I'm scared. I'm very scared.
Absolutely, and I completely understand. Lupus is a lifelong condition, but it is manageable. With the treatment, routine monitoring, and self-care, many people live long, fulfilling lives. Always remember that we are here to support you every step of the way.
Thank you, Haley. This makes me feel less overwhelmed. I really appreciate all the information you've given me today.
Yeah, of course. Before you leave today, let's go ahead and get your lab scheduled with Dr. Lewis, and let me provide you with our contact information, and any questions or concerns that you have, please reach out.
Okay, thank you.
Yeah, of course.